Hi, I'm Lou Hall. I am one of the evaluation leads at the Southwest AHSN. And firstly, I just want to say how my heart is warmed that there are 45 people on the call listening to Theory of Change. That is just fantastic. So yeah, I'm just going to spend a few minutes talking about my experience of the benefits of using logic models, theories of change, just that kind of that process really, and why we at the Southwest AHSN use these for all of our programs. So next slide, please. Part of my job at the AHSN involves working with innovators and service delivery colleagues across the healthcare system. And that my role is to kind of help people to articulate the measures and the benefits of the work that they're doing. Obviously, before we can do that, we need to understand what they are. So I've been doing this for some time now, and I'd never really thought to apply that logic to my own work. So what are the benefits of doing evaluation? Above just kind of reporting back to commissioners and funders, and why should you spend time doing that when you've got patients to see and deadlines to meet? So until recently, I'd kind of thought that was quite obvious. It's just about accountability and making sure that we're demonstrating our impact and that we're spending money wisely, and how will we know if we achieve our goals if we don't measure them along the way? Next slide, please. But evaluation, I think, is just so much more than that. And the tools that we use within evaluation are just so much more than that. It's more than bringing together findings from surveys and patient records. It's a process. It's a process that should start at the very beginning of a project or program and really support the planning and the decision making and the delivery of that project, and really support it to achieve the things that it's trying to achieve. Next slide, please. So one of the first things I will do when I'm working with somebody around evaluation or just a program generally is to develop a logic model. We could start with the theory of change, we could start with a logic model and build the theory around it. It doesn't really matter. The point is that you're having these conversations and that you're talking about these particular things. So as Jan's kind of mentioned, the logic model that sets out the problem you're trying to solve, the goal that you're trying to get to, the outcomes you're trying to achieve, and all the activities that you're doing along the way to try and achieve those. So just doing this activity alone, just having people in a room together, filling out or working together to kind of fill in the logic model or talk through it is really beneficial in and of itself. And next slide, please. So that's because, I mean, for me, in my experience, bringing together stakeholders, it's a real opportunity for people to clarify the scope and the purpose of the work that's being done, and to really talk through the different elements of the product or the service and create that shared understanding. I can't tell you how many times I've been in a room where people have really different views about the project or the initiative and the scope of it. And so it's just really beneficial to have people in a room together to have that space. So just to run through a bit of an example of something where I've done this in the past, I was once facilitating a development of a theory of change and a logic model for a co-design service. So it's supporting people at the end of life, and it's two different organisations coming together to do that. Both very well known. The benefits were really clear for both organisations. They were working to the same activities. So it was a rapid response service, and their activities were around a carer calls a rapid response service, a nurse offers support over the phone, the nurse visits the home, they deliver some care if it's needed, so administrate meds or change the syringe driver. They explain the process to the carer, they support the carer, and the outcomes were the same as well. So they were trying to get more patients able to remain at home, reduce burnout in carers, reduction in 999 calls and A&E attendances, the usual. But when I started to push for more details and started to really kind of challenge some of that logic and have these conversations, something became quite clear. So I asked why a carer would call the service, and one of the organisations said, seeing a loved one, particularly a child who is dying, is really difficult. It's really emotionally exhausting and physically demanding. The body goes through a number of changes at the end of life, and it could be really distressing for carers to witness that, and very often they feel like something's happening or it's going wrong. So quite rightly, they seek reassurance by calling 999. Now, with this service, the district nurse would let them know that this service existed, hand them a card, and when such an event happened, they would be calling this number. Now, up until that point, we talked about services and outcomes, we talked about patients and carers, but we'd never mentioned the word children. So one of these services supported everybody at the end of life. It was their remit, they had to, they couldn't specify one particular area. The other service only worked with adults, and they were only insured to work with adults. And it actually happened that they'd been through contractual agreements, they've been through partnership meetings, many meetings, and it wasn't until going through this process and really starting to unpick some of the detail that they realised that actually that particular partnership wouldn't work for that particular service. Next slide, please. So as well as being a useful tool to bring stakeholders together, it's also really useful to start to support the kind of the challenging of the links between the intended activities and the outcomes. So you could do this in a kind of at a large scale level, at the theory of change level, or in the particular detail level in the logic model. So you can kind of start to identify where there might be some gaps or a lack of clarity. And then by testing that project logic, you're essentially ensuring that there's sufficient planned activities happening to get to those outcomes. So I've got another example for you. I worked on a project where one of the outcomes was improved patient activation. Wouldn't we all love to do that? So they had a number of planned activities linked to that. So I'm just going to read what they were. They were clinicians offer access to a video library via a link to patients. The videos are themed for ease of access. Information videos are available to view. Patients access the videos and watch the videos. There's then a list of linked organisations on the site after the video. The patient then uses those links and accesses different organisations to get to serve themselves for help. So that seems quite logical, that makes sense. You can see that those activities link to those outcomes, but actually there's quite a lot underlying that. And I wanted to challenge that in a number of ways. So what would be motivating the patient to access the sites? Will the patient be able to find the relevant video for them? How will they know that? How will they know to look for further support through the links? How will they find the relevant links? Because organisation names aren't always relevant to what they do. And what will make the patient motivated to go to those links and click on them and actually seek that support? So through having these conversations and challenging some of the gaps in the logic model, we were able to support them to kind of come up with some more activity to support that project to be more successful. So they included, just as some examples, promotional videos, promotion of the video through posters. They had check-in screens at the primary care level. They had business cards, I think, that they were handed from their clinician. And then within that promotion, that included, why you would access other organisations and why you'd want to do that and the benefits of doing that. They set up primer questions on the site so they could direct patients to a most appropriate video. And the links to the organisations were linked to the video, so that the relevant links were then available for people to use. And then the clinician started to mention that and kind of primed the patient for what to expect on that journey and how to kind of navigate it. So by going through the process of challenging the theory and the causal links and the assumptions of the project, we were able to support the project to meet their outcomes. Final slide, please. Thank you. So of course, that was hugely oversimplified for what is a very complex process. And, I just had a few minutes to talk to you, but hopefully it gives you a sense of why doing and using theory of change is really important, not just as a tool for evaluation, but just in the context of using it within programs. So before a single piece of information is gathered or reported, your theory of change can support clarity and unity and understanding of the project, its context and scope, activities and outcomes, and it can identify activities that may not have been considered in order to help the project to achieve its outcomes. And that's it from me. Thanks.